Today on Docs Toc, Dr. Ladan Hariri is back. Dr. Hariri is a psychiatrist with an interest in women's health. This interview continues our series on women's health. And today we talk about a condition that I had never heard of before called PMDD, or Premenstrual Dysphoric Disorder. We'll define what that is, symptoms, treatment options, and we're going to learn lots from Dr. Hariri as usual.
Yes, this is, I think, a very important topics between PMS and PMDD. As I see many patients, young people, they come with sign of functional bowel disorder, but which are mostly get exacerbated during their menstrual cycle, and it can be very debilitating from work point of view, as well as their symptoms, as well as the family time. So I think it's very, very important that we look more detail on this and to appreciate what are these changes hormonally does to the female, and be appreciating their feeling through this period.
As always, if you'd like our videos, hit the like and subscribe button. Also, please drop a comment in the comment section on Apple, Spotify, or whichever platform you're using. That helps the search algorithms push this podcast out to individuals so others can find it more easily. Thanks so much for listening. And without further ado, here's our interview with Dr. Ladan Hariri. Welcome to Docs Toc. Today we have Dr. Ladan Hariri returning. We're so glad to have you back, Dr. Hariri. And this is episode 50, so it's a milestone for the podcast. So we're so happy you can join us for this very special episode.
Thank you for having me. I didn't know it was the big 50. What is that? The golden anniversary or the platinum?
I think it's golden.
Yeah.
Golden?
Yeah, I think it's golden.
Yeah, it's so great to have you here.
Oh, I'm so happy to be back. Thank you for having me.
So this topic of PMS with a PMDD is, for most of the male physician or male audience, they don't understand it, and sometimes they brush it off. And I see so many patients suffering from that. Can you elaborate on that and tell us what it is, what's the difference, and so we can have some easier understanding of it.
Absolutely. And again, thank you for bringing this as a topic to your audience, because it is so taboo, right? And the example that I always use is that, let's say a couple decades ago, we weren't really talking about breast cancer awareness. And now I believe it's October, that all the NFL, they wear the pink shoes, and, NBA players are wearing pink shoes on the court because it brings awareness. So it is so important to bring awareness to these more taboo and less talked about subjects. And PMS and PMDD, there is a big difference between the two. And when you say these letters out loud to people, they just don't even know what they are, or that there is a difference. So first of all, thank you for inviting me here to raise awareness. So I think that everyone's general understanding of PMS is very much what we depict in Hollywood, or what you see on TV shows, or what you see on Instagram, is that it's the time of the month and your girl gets real grouchy and you have to just throw her chocolate from across the room. And we kind of, we poke fun at that, but at the same time, it's really not as maybe it's not something we should make too much fun of, but we just kind of laugh it off. So the difference though, so what does it even stand for? So PMS versus PMDD. Okay, this is the way I like to say it: premenstrual dysphoric disorder, PMDD, versus premenstrual syndrome, PMS. The difference between the two is that PMS is kind of like the annoying friend or the annoying cousin that comes and visits you once a month, and they hang out and they're annoying, but you get through it and everything is fine. Okay, versus PMDD, who is perhaps a very, very toxic friend who comes and stays with you for a whole week and just causes complete havoc in your life. Okay, so that's where we're seeing that it's more debilitating, full on mood changes in PMDD. So we're seeing clinical depression symptoms, rage, anxiety. For some patients, they can even have a mild to moderate to even severe psychosis. So it might look like you're seeing someone who's having a bipolar disorder, like a mood fluctuation, and it happens for about a week, and then their period starts, and then all of a sudden they feel better, and it's like nothing ever happened. And it's very, very confusing for women, and it's very confusing for the people that they work with, the people that they live with. Is what is this Dr. Jekyll and Hyde? Why does this happen for 1 week out of every month? And then it's like nothing happened at all. It's very confusing, as you can imagine. So I guess the difference between PMS is PMS, you get, as a woman, you want chocolate, you want anything that has magnesium. You're kind of snappy, you're kind of edgy, you're kind of grumpy. Um, but you're tolerable. No one has to actively avoid you. PMS is uncomfortable. PMDD is debilitating. And that's why I always say that the two D's at the end in PMDD are it's for debilitating, right? So why is it important to kind of recognize that there is a difference between the two? Because the treatment for the two is very, very different. So a lot of times women will experience symptoms of PMDD, but they think that it's just PMS when in actuality, it's very, very different. Symptoms, again, for PMDD, it has such a wide range as well. But the end of the day, the question that you have to ask yourself when you're sitting in front of a patient, or as a patient that you should ask yourself is, okay, these symptoms, are they affecting my quality of life to the point that I can't function for a whole week out of every month? Okay. So we're looking at symptoms ranging from crying over a cute dog food commercial to literally threatening to divorce your partner at the drop of a hat, right? For maybe breathing too loudly or something. But with the severe irritability, the depression, the anxiety, the bloating, you're still getting all of the other symptoms of PMS, like breast tenderness, fatigue, sleep issues, all those things is pretty much PMS, but put that PMS on steroids with all the other things, right? Most patients that I see, they're getting diagnosed probably in their mid to late 30s, which is really unfortunate because that's actually at that point, you're in the season of your life where you're getting ready for the big change, which is menopause. So by the time patients are in the perimenopause age, that's when they find out they've been struggling with PMDD. And it's really unfortunate. Um, but I have found, when patients hear, yeah, I think you have PMDD, that in of itself makes them feel so much better because they feel validated. I had one patient tell me, wait, so I don't belong in a psych hospital. There's not something broken in my brain. I said, there's nothing broken in your brain. It's just that your body is reacting in an extreme way, whereas maybe other women that you've been around, their bodies don't react that way.
Yeah, I see a lot of patients with functional bowel disorder in their 20s and 30s, and just they go from doctor to doctor to find the things, and they, when it comes near the cycle, they're actually a couple of weeks ago, I had parents they bring us, so she cannot go to work, and anatomically there's nothing you can see but symptoms that she says she cannot go to work because either she get bloated, nausea, or she has to go to the bathroom, or she's just feeling strange at the work, and unfortunately this just, when they go to OB, just get quickly brushed off. And while there's symptoms, you can tell. I mean, you just did a brief history. It says, "How you doing?" It says, "I'm doing great 2 weeks, but then I'm horrible during those periods." So yeah. So I think, and once they know the diagnosis, I think they can cope with it. They know something, and just brush it off. I think that's more frustrating than that. So what do you do? Dietary thing, and what the treatment?
Could I just jump in? I just wanted to ask, what is do we know the mechanism? Like, is it hormonal? Is it estrogen dropping, progesterone changing? Do we have any idea?
That is a really, really, really good question. There are several theories at this point. Several. No one can seem to quite pinpoint what it is. but it always seems to go back to progesterone. And I always say progesterone, for all the wonderful things that it does, it just seems to be the PMS, PMDD, and postpartum depression, women's worst enemy. It's that sudden shift in progesterone is what it is right now theorized to be. But we're still not sure because, to be honest with you, because we're so early in sorry, you can probably see my dog here in the frame as well. She's my little office manager, as I always say, and she's trying to get off my
Don't
chair.
feel bad. Rob has his cat.
Do you?
I've got a Persian cat,
Oh
or
my
excuse me,
gosh.
a Siberian cat. Excuse me, that's
Oh,
jumping up and down here.
that is amazing. Okay, we'll have to introduce them. So I'm sorry.
Yes.
She's trying to signal to me that she wants to leave the office, and that's not an option right now. Um so because we're so early in recognizing that this is a disorder and that there is a need to explore it more, I feel like it's constantly dynamic. So I feel like every single time I sit down to do something with CMEs and I see a new article, it has a new hypothesis, so to speak. But I would say that the latest one is that it's the sudden shift in progesterone, that had the progesterone kind of been spread out a little bit evenly in terms of that change, that you don't see these symptoms pop up as much. And that's actually why the treatment for PMDD involves a progesterone based birth control, so that it allows for you to be more leveled on progesterone so that you don't have those sudden changes. And that's part of the treatment. So I would say that's what we think it is right now. Who knows 10 to 20 years down the line what we actually think that it might be.
What about the effect on endometriosis? Because I see sometimes patients that they had that, they even have more severe symptoms.
So your question is if you have PMDD and you have endometriosis?
Right.
Yeah, so that's when you see a much higher IBS type picture. More so also, it seems to be, the studies at least show. And again, these studies, you have to bear in mind how many women are being looked at, what are their ages. You really do have to look at the studies, but the overall conclusion that I have made after reading a lot of these articles is it seems to me that the endometriosis crowd for PMDD, they tend to be more on the IBS-D spectrum of things. So we have IBS diarrhea, IBS constipation, and it seems to be one of the telltale signs is you ask a patient when that 1 week before your period, when your symptoms seem to flare up, do you notice that your IBS diarrhea is flaring up too? So that tends to kind of be a hint of the correlation.
So what's the diagnosis, this syndrome? How do you treat it medically as well as dietary?
I love this question. So we like to talk about the golden triad in PMDD. This one is going to blow your mind. So the first thing that I always start my patients on, and really every woman should be on this, is calcium carbonate, high dose calcium carbonate, which is the active ingredient in Tums supplements. Those like awful chalky tablets. Yeah, in any antacid. You want to shoot between 1,200 and 1,800 milligrams a day. So all you do is you pick up that little bottle of Tums, you take a look and see calcium carbonate and how much is in it, and you take enough tablets daily that it adds up to 1,200 to 1,800 milligrams a day. Pretty sure that with a lot of these Tums formulations, that typically tends to be 2 of the extra strength, but always check. That's the first thing. After consistently taking that daily, after about 3 to 4 months, before making any other changes in their treatment, I've had patients tell me, whoa, this made the biggest difference for my symptoms, believe it or not. And not only that, you're also setting the patient up to be able to avoid, all the risk factors that also come with having PMS, PMD, any of these PMS, PMDD type situations, or endometriosis. I mean, all of these are women's issues. Well, what's the biggest concern that we have for women? Osteoporosis as they get older. So we're really setting the patient up for success. So no matter whether you have PMDD or not, all women should be on a high dose calcium supplement. And also, I mean, honestly, calcium carbonate, that's so simple. It's over the counter. Anyone can get their hands on it. The second part of that golden triad is SSRIs. So a lot of times I have patients that will go on Zoloft or Prozac or Lexapro for exactly the week before their period. They know they literally they put it in their phones. They schedule it that their phone tells them, hi, it's that wonderful week. So they'll start taking low dose of SSRIs for that 1 week, and then they even choose to stop when their bleeding starts. Your question would be, but that doesn't make sense. SSRIs take 4 to 6 weeks to really marinate in, but in the case of PMDD, it's actually been shown to be pretty effective in terms of leveling things out for my patients that have PMDD. And then the third and final piece, which is kind of optional, just depending on the patient, is going on a hormonal birth control. The one that is most preferred for patients is the NuvaRing because it is a more localized release of hormone rather than systemic with oral birth control. But that's the magical three. Nutritionally, though, I would again say you want to look at, I mean, I think everybody loves magnesium at this point, and it really does make a big difference. But if I really had to choose, let's say, the 3 vitamins to put your focus on: omega-3 fatty acids, which is fish oil, calcium, which you can get from the Tums, the calcium carbonate, and vitamin D, which you can either buy that separately or make sure that your multivitamin has enough of it.
What about exercise like yoga or other type of mental relaxation techniques to be able to cope with these things?
Exercise seems to be the medication for everything, and I completely agree with it. I would say, okay, the stress management that comes with exercise is what's most important. If it's going to stress you out to go to the gym and you feel like that's where your buttons are going to get pushed, don't do that. Stay home, do yoga, do just walking by yourself. It's exercise to actively text people on your phone and tell them, leave me alone for the next 7 days. Like whatever you need to do, which won't stress you out. So yes, exercise, meditation, yoga is so important as long as it's not adding to your stress. If it means that you're having to stress yourself out more by getting in the car, driving to the yoga studio, getting triggered by the annoying front desk person, maybe she's really annoying, don't do it. Just do what you need to do to manage your stress. It's like, you know what I mean? It's like you get there and she says, you're 10 minutes late for your session. It's like, oh my God, set yourself up for success.
Are there any support groups or organizations that help?
Absolutely. Before I lose you, though, what I should also do, because my charger fell out as I was talking to you. It's like my charger also has PMDD. Okay, there we go. We're back. Okay, support groups. Yes, absolutely. Do you know what's very underrated? Actually, in terms of support groups, would you believe is Facebook is what I've heard from a lot of my patients. For whatever reason, patients love Facebook groups. They find it to be pretty supportive overall. What I understand is as well, I have looked into it. It's called NAMS, NAMS, the North American, is it Menopause Society? Let me double check because yeah, it is the Menopause Society. And before the audience gets super confused, yes, it's Menopause Society. I'm not saying that if you have PMDD, you're in menopause yet, but they have resources. So that's the thing is NAMS has resources that pertain to women's health. So NAMS is really good. I'll be honest with you, ChatGPT, a lot of my patients tell me that ChatGPT has become their on-call therapist, that they will type in their symptoms at 3 o'clock in the morning and ChatGPT will very gently talk them down that really, really high stress moment that they're sitting in. Yeah. Have you heard that from your patients, by the way?
A
Chat
little bit, a
GPT.
little bit. They're using it. They're bringing in the responses. Yeah,
You're
it's
too
kind of
much.
Too much.
yeah,
I agree. Too much.
yeah,
Too
I
much,
agree.
yes.
it's got a ways to go before it becomes a clinician.
Oh,
But
I
it's
agree. I agree. And like the empathy of it too, it's like, okay, calm down. But yes, no, when utilized appropriately and when you recognize that ChatGPT doesn't understand the full scope of who you are. But I've had a lot of patients tell me, I learned about PMDD from ChatGPT, and then they come to me and they say, do you think I have it? And then when we go through the discussion, whether they have it or not, they feel like they were heard. So because that's the thing too, like realistically, how difficult is it for a patient to get an appointment with a clinician?
And understanding and taking times. So I think it's being alone and unknown. I see a lot of IBS patients, and especially since I came to California. So it's a lot of unknown and stressors, and the top of these hormonal changes, and not having somebody to listen to you. And then once they found it, other people like themselves, then I think that's, even there's no treatment, I think they feel better. They're not. They ask me, for example, is this in my head? I says no. This is something. I explain to them as a Charlie horse or spasm in your leg. Says when you have that, you feel it true, but you can go to emergency room. Maybe CAT scan, EMG is negative. It doesn't mean it needs suturing, but what you're feeling is true, and that sort of sometimes will help them to calm down when then you get appropriate treatment, and with a diet and many tips. And each person is different. It's just based on their age too. So what do you see the future of this? What do you see on the horizon for this type of people?
I feel so hopeful actually, because I'll be honest with you, and I do feel like with all the challenges of being, I'm a millennial doctor. My husband's a millennial doctor. I think we have our own, every generation of doctors has its own unique set of challenges. Um, I I will say that I feel hopeful because within, I think, my generation of doctors, and I'm not sure where the shift, when and where the shift happened, but what I have noticed is the collaboration seems to be there between specialties. For instance, look at what we're doing right now with our podcast. Look at this episode, and what's happening is, let's say 10 years ago, you didn't have this option to be able to type in PMDD and be able to hear two very, very, very experienced physicians sit down with a psychiatrist and share their thoughts and share their experiences on what's going on. You didn't have that resource. You didn't have Instagram where you can follow hashtag PMDD support. You didn't have YouTube videos. You didn't have ChatGPT to even point you in the right direction. So I actually feel very hopeful. As toxic as social media can be, I think that all these tools, when used appropriately, can actually be a good thing. It really can. So I see a world where, when we have the talk with our daughters about, oh, guess what? Your body's going to go through some very fun changes. I think that my generation of mothers, we are more aware of PMDD because we've heard it so many times, and we can kind of observe our daughters and see, okay, for 1 week out of every month that my daughter is going through her period, is it that she's struggling for about 1 week, or is she struggling for a good 2 weeks, 3 weeks? Because that's the other thing that I do want for the audience to take away is the classic story that I hear from a woman who comes in with PMDD is, doctor, I only get 1 good week out of every month. 20, that's 25% on average, right? When we say usually there's only 4 weeks in a month, I get 1 good week. So I'm only living really 25% of my life since my period started around the age of 11 to 13, maybe 14. And when you break that down, this is why. The week before your period, if you have PMDD, the week before your period, life is awful. Everything's awful. Everyone hates you. Nobody likes you. You don't even want to exist. You can't work. You can't do this. You can't do that. Nothing makes sense. And then your bleeding starts. And then all of a sudden you realize, oh, it was my period. Everything's okay. But then that 1 week that you're on your period, it's so uncomfortable and gross, and you feel bloated and nothing feels right. And your skin's breaking out, and it's just like, wow, so glorious to be a woman. So that's 2 weeks. Okay. The week after your period is done, and you're feeling more like yourself, that's when you sit down and you reflect and you realize and you feel ashamed and embarrassed at the behavior that you maybe had during that 1 week before your period, and how you snapped at your partner, you snapped at your kid, you yelled at your dog, you got in a fight with your neighbor, you sent a snarky email to your boss. That's when all the shame and regret settles in. And then after you settle with that, the next week feels normal. And then guess what? The horrible week from hell starts all over again. And it's a horrible cycle. So if you notice that in somebody that you love or someone that you know, I guess it's something to be aware of, that maybe this person is actually struggling with PMDD and they themselves don't know it.
That's super helpful, and I particularly like the idea about the calcium. It's a very, it's low cost, it's low risk, and it sounds like it's helpful for many patients. That's something that primary care can do, and I wonder if they know, if primary care knows about this. That if not, they definitely should.
And it helps with heartburn and digestion, as also as diarrhea too.
Yes. Wait, who in this room doesn't suffer from heartburn? I would like to know. My dog sure does. I do.
Well, the reason I become gastroenterologist, I was going to become cardiologist. My professor says, "Hey, look at what Americans are suffering. It's all from tummy aches and heartburn. Go do something common and do it uncommonly well and be successful." Says everybody suffer from tummy aches and reflux.
It's like in any we always joke around that any doctor's office that you go to, you know how like the doctor has their clinic and then they have their own, little workspace. I swear, like everyone has their phone charger and their little bottle of Tums. It's just standard. It's if you ever need to give a new graduate from medical school or residency a gift, give them Tums. Just give them a brand new sealed bottle of Tums. Believe me, they will use it. We all need Tums, and all of us need calcium. I mean, how awful is our Western diet?
Especially during residency when we're eating at like 2 a.m. and whatever time in like 5 minutes between calls. So yeah, I remember that.
Yes, coffee. We operate on coffee.
As you talk about the technology, we are doing a series on AI in medicine. As you mentioned, that the medicine is changing, and I think the AI is going to be tsunami and change everybody's perspective of what we're practicing, how we're practicing, and of course patient access. So I think I definitely understand that the technology makes the people more aware of it, and hopefully it's better for us to treat our patient better. So yeah, we're doing a series on AI as well. So hopefully that'll be helpful to our audience.
I desperately need to learn about it. I'll be honest with you. I'm so excited but so scared about the future with AI and how that's going to affect us not only as physicians but as patients.
I think we have no choice to embrace it because it's coming whether we like it or not. So I think hopefully we have able to at least use it properly.
I think so. I mean, I will say my last experience with using ChatGPT for medical advice actually pertains to my dog. She's a rescue and she just has a very traumatic history and she's always had a very sensitive stomach, very sensitive. And one night she was throwing up a lot and I thought, oh my gosh, it's either her acid reflux or it's the doggy flu. And I kind of I referred to ChatGPT because it was about 10:30 at night and I didn't want to wake up my husband to kind of get his opinion on what I was about to do for her. And ChatGPT scared the living lights out of me. It went so extreme. It was so inappropriately extreme. And then I did have to wake up my husband. I felt really bad. And he said, look, what let's talk about it. And we came up with a good plan and she was fine. But I think you have to also just, bear in mind that it is different. AI is different at this time. I know that it's evolving constantly, but maybe don't let it scare the lights out of you like I let it scare the lights out of me.
before we had Dr. Google's, now we have Dr.
Yep.
AI.
Dr. Chat.
So
Yes.
they come with a list of things, I ask for this, what do you think? Yeah.
No, and then now there's Grok, and then there's something else, right?
There's
there's a lot of
Claude,
Yeah, Claude.
Anthropic's system. Yeah, I have not used that one yet, but they're all kind of the same sort of thing.
Right.
Yeah. But and the fascinating thing that we talk about this in the segment is no one really knows how they work, which is also really kind of interesting and freaky that they go into the information goes into this thing called the transformer, and it somehow figures out how to parse the information, the question, and then give a response. But no one actually knows how that is actually happening. It's really
the
weird.
Transformer? Am I AI and I don't know? Is it possible? Sometimes I scare myself. Like, it just gets too scary. I tell my husband watches a lot of he's very smart. So he loves to watch podcasts and learn. And I can't learn too much because I start to panic. I'm like, whoa, what if I'm an alien,
In the future, you never know.
I don't know. I don't know. I'm like, am I? And nobody told me. Is it the plot twist in the movie? So it is a very exciting time, I think, for all of us, but it's also pretty terrifying. So
there is a transition, definitely more than fax, cell phone, all of those. They came, and email. We have adopted, when an email comes, nobody trusted it. Then we all use it. Then the same thing, cell phone always too. Now, but this is I think is a mega force, and I think hopefully it's all for the better, not good. So I'm optimistic. So
I hope so too. But if they could more so prioritize that robot that can help you out around the house and cleans and does the baseboards, that would if we could prioritize that, I would personally appreciate it.
It's coming. I believe. I'm also have an interest in that kind of stuff. And Musk is going to take Tesla to Optimus, the robot. So it's coming. It's coming.
We've been hearing that. I've been hearing that since my son was like an infant. I'm like, well, where is it?
I need it now.
It's coming. Yeah, they're going to become it's like a robotics company. The cars are going to become like a lesser important product that he sees as the most important product of all time. So we shall see.
I will pay whatever. I heard that they can even do your nails. They can be your hairdresser.
Rob, I know we don't need that. But I appreciate all the rest.
It would be, I mean, in terms of, having a helper or helpers to help with, it's that true idea of technology that we can then do more interesting things, right? Yeah. It's going to change the face of like the workforce. I mean, it's going to drastically affect
scary. I'm
things.
So scared. I'm so scared, but at the same time, like, all right, we're on this ride. Let's see where we go.
Yep.
Hope it's okay.
Yep. So how can our audience reach you? And do you have any final thoughts or final recommendation?
Final thoughts, final recommendations is you don't have to suffer. If you feel like there's something wrong, especially women, this is a women's issue. This is a women's issue. Cancel me if you must. This is a women's issue. Women have a very, very strong sense of intuition. The trick is you got to listen to that little inner voice inside you that says, this doesn't feel right. This feels like it shouldn't be like this. Go talk to a doctor and ask them, particularly an OB-GYN. I think it helps to start with an OB-GYN. If you can't get in to see a psychiatrist immediately, I know that it is a challenge to get in to see a psychiatrist, or maybe you don't feel quite comfortable yet. We are an acquired taste. So, but just go in and say, I think I might have PMDD, and track your mood and track your periods on your phone. There's lots of trackers. I am not sponsored at all, but you can literally use, there is an app and it's for free, and it's called Belle, BELLE, and it is free. And I think that it does a pretty good job of privacy, which is a big concern for women. But that's the thing, is start tracking on an app, whichever app you feel comfortable with. Take the data to your doctor and say, do you think this is kind of wonky? Speak up. Now, how to find me? You can find me in two places. So either you can find me at my concierge practice, which is my private practice, and you can actually just go to my website, resultpsychiatry.com, RESULT psychiatry PSYCHIATRY.com. Or you can find me through United MD, and let me look up that website because I still don't know it. I'll be honest with you. I'm sorry. See, I have brain fog. There's nothing wrong with that. Okay, I have a phone number. You can call 949-502-5572 if you choose to see me through United. So either way, you can find me.
Wonderful. Thank you so much for doing this.
You're welcome. You're welcome. Thank you for having me again.